4 hours already. I think I need help. I just need to get out of this room.
Dave, are you still in there?
I'm trying to get this out. It shouldn't be this hard.
Mate, you've been in there for ages.
I don't know it!
Come on, Steve. I can't do this anymore. It's me or the poo!
Don't say that. It's not my fault. I'll be out of here really soon, I promise.
It's over!
No!
Dave, come on, for f***'s sake, I need a piss!
My girlfriend's left me. I've lost my job. All I want to do is have I need I mean
There you go. Constipation can be a serious health problem. Whatever goes in has to come out eventually. Now, why is constipation affecting more women than men? Let's find out.
This shouldn't be shy to be announced. Fact is, we women are more disposed to constipation and colorectal disorders compared to our male counterparts in a similar environment. The prevalence of constipation is of 50% of the elderly community. 74% of elderly nursing homes residents use daily laxatives. Simply speaking, if you experience difficulty with your bowel movement, then you're facing constipation problems, also known as sembelit in Bahasa Melayu. Why is it such, you ask? We women learn to suppress the urge to move the bowels and withhold stools 3 times more likely than men. Besides, anatomical differences play a role. We are naturally skilled at using abdominal and pelvic muscles to deliver babies. That goes to using our muscles for the wrong reasons. Why do we still ignore the calling and signals from our body, consciously suppressing our stools? Keep those questions running so that you'll spend lesser time stuck in the toilet. Over to you, Lisa.
Thank you. So there you have it. Explanation on why women are more afflicted with constipation compared to men. Because we are, well, natural, givers of life. And in that case, in that sense as well, that we take in more, pain threshold, and we are more patient, and we take in, we just hold on to and able to hold on things for a much longer time than men. Now, I have with me here Dr. Kwan Leong, who is the Consultant General and Gastrointestinal Surgeon from Tropicana Medical Center. Also, Sandra Locke, who is a clinical dietitian from Subang Jaya Medical Center. Good morning.
Good morning.
Good morning.
So we have seen now women are more prone to constipation compared to men. Now, why does constipation happen? You think that, things go in smoothly, it will come out smoothly, but why does it happen? Doctor?
Okay, coming to your first question, why women is more common to that? Actually, it's very easy because women don't drink water.
Oh.
As now, all of us know very well that, I think especially for the ladies, you know very well that especially if you work in the office and all these things, if you drink water, you need to go to the toilet quite often. As such, especially office lady, they try to avoid drinking water so that they need not to go to the toilet often.
Dear.
And one of the functions of our colon is actually to reabsorb water. So if you don't drink enough water, that means we have to reabsorb more. As such, the stool will be harder. That is as simple as that.
I see. So is water the #1 factor for constipation?
Water, fruits and vegetables. Basically, water and fibers. Yes.
Okay.
Yes.
Right. When it comes to then food, like fibrous food, I mean, you have lots of vegetables and choices of fruits as well. So you're saying that daily consumption. So how much should we be consuming? I mean, do you want to have vegetables even for breakfast, doctor?
She will tell you the 5 portions a day. 5 14.
Yeah, I think I'll be more suitable in selling all this. According to the guidelines, we have a recommendation. All of us is advised to eat 25 to 30 grams of fibers a day. But to visualize how much is it, usually we recommend to eat 5 servings of fruits and vegetables a day and go more on whole grain products for your cereal.
Now, why is it important then to actually eliminate stuff from the body? I mean, this waste, you know, Doc.
Okay, this waste is basically, all of us know very well, our stool definitely is to eliminate toxins, and also, of course, our stools have bacteria. Now, one of the theory of colon cancer, okay, is actually, and people used to say that if you have constipation, your risk of getting colon cancer will be higher, which is true. The reason is because our stool has a lot of toxin and bacteria, and if you have constipation, that means the stool stays in our bowel for quite some time. The contact time between the stool and the bowel cells will be longer, and then the cells start to change.
Right, I see, because of this pathogen, this bacteria that's inside
and
the
all the
colon.
toxin, yes.
Okay, so Doc, if let's say we eat something, right, breakfast, you know, how long should that breakfast be coming out in your toilet visit?
It very much depends. The reason is because some people, their bowels or their guts move faster. Some people, their bowel move slower.
Oh.
But generally speaking, after 12 to 24 hours.
12 to 24 hours. So in essence, in a day, there should be at least one toilet visit.
Yeah, now that is also another thing, which is what, actually it very much depends on the individual. A lot of people think that you must go to the toilet once a day, and that is normal. But that is not the case, because some people are born, even from their very start, they goes to pass motion every other day. Some people pass motion 2 times a day. So do not please, especially to public, please do not think that I must pass motion once a day or else I'm abnormal. No such thing. But if you only pass motion like twice a week or once a week, yes, that is abnormal. That is
sounds
constipation.
Scary, doctor.
Yes.
I mean, once a week you have all that decomposed waste sitting inside, baking inside your colon.
Yes.
Right. But would you say that someone who passes motion twice a day is a little healthier compared to someone who passes motion once in 2 days?
I wouldn't say so.
Say that?
I wouldn't say so.
From your surgical practice, there is just no difference.
No difference. Yes.
Wow. Okay. Because we have been taught up to think that, you know, everyday toilet visit is a really healthy habit.
I mean, if it's naturally, yes. But unfortunately, there are people now, because they believe that passing motion once a day, it should be that way. So if even they don't have the urge, they will just go and strain and strain and strain it all out.
Oh dear. Okay. Yes. All right. So now talking about the toilet visits, defecation here.
Yes.
How long should one attribute timing? I mean, is there such a thing as a healthy timing, a duration you spend in the toilet, as opposed to an unhealthy one?
Okay. Now, first of all, I just want to mention that passing motion is actually a very strenuous process. You need to use a lot of muscles.
Yes.
Compared between a sitting toilet and a squatting toilet, you know, you need to use a lot of muscle. It's a very active process. So what I'm trying to tell the public is, if only when you have the urge, then only you go to the toilet. Now, I know some people, they are very particular in passing motion every day, and some of them must do it in the morning. So they will go to the toilet even though they don't have the urge, and they will sit there and strain and strain and strain. Now, that is not healthy. That should not be the way.
But you know, doctor, I've seen parents, all right, educating and training their young toddlers to sit on the potty.
Yes.
Even though the child is not even wanting to go. So sit on the potty and then they go, they have all these different sound effects just to encourage the child to pass motion. So you're saying that is not actually a healthy habit?
Now, the thing is, I mean, training the toddler or the kids, because, you know, they are not used to it, it's okay. But not until if the toddler, after the training, it doesn't, he or she didn't pass out anything. It's nothing wrong, but if they can pass out, that will be good. Then basically you mold the bowel habit of the child. But what I'm worried is some, sorry to use this word, obsessive parents, they must force the child to pass it out. No. Training is okay. If the child pass out, good. If the child doesn't pass out, it's okay. But not until so obsessive, until forcing the child must pass it out.
Okay,
Yes.
all right. I hope parents there who are listening are taking note. Now, Dr. and Sandra, we have taken our cameras out and we asked people on the street, now, if they are always affected by constipation, let's just take a look at what they said.
Sakit perut selalu lah. Kalau visit tak?
Not quite often. It depends because normally I get constipation when I travel overseas.
Okay.
Not really in Malaysia. I don't know. Not.
I guess maybe 5 to 10 times, I guess. I don't know if it's too much. I sit on the toilet bowl.
And just let it go.
And just let it go.
Not that often. 2 kali setahun kot. Kurang 2-3 kali je kot.
Yes, it's a tough thing. I think it's due to bodily heat and the food that we eat that is too spicy and causes constipation and lack of proper hydration. That means we don't have enough water, fluids, fruit juices. That causes constipation.
Not very often, at least like once or twice every 3 months.
Almost zero, because every time once I wake up, I will straight drink oats. And after that, whoa, the feeling is coming.
Hardly, because my husband is a dietitian, so I think once a year.
Maybe once or twice, because I have a good diet.
3 or 5 times like that lah.
Thank you so much, people, for being so honest about, your bowel and toilet visits. I think that really helps other people kind of be educated on this topic. Now, Sandra, as a dietitian, is this a true or false statement? Coffee can help ease constipation.
Okay, so a very common thing that people will think is that caffeine can actually help to stimulate bowel movement. I don't deny this, but this is not a 100% true or false question. Reason behind, caffeine can help to stimulate our bowel movement, but however, caffeine is also a diuretic, meaning they will make you tend to urinate more. If let's say you're not getting sufficient water, you will actually worsen the conditions.
I see. Okay, so if you drink a cup of coffee, you have to supplement it with probably 1 to 2 cups of water.
Can say so.
Okay, all right, okay. Now, eating things like oat bran or porridge or oats, can that help ease digestion?
Okay, mainly reason behind is this food usually high in fiber. So back to the story in the beginning, it's because of fiber, not enough, causing constipation happens. So this thing, when we increase in consumption, definitely it helps in passing motion.
I see. Okay, so if you are facing terrible constipation, then things like oat bran or even oats porridge is a good thing. All right, now we're going to take a quick break, and when we come back, we have so much to cover here on Bella Confidential. Welcome back to Bella Confidential. Now, today we're talking about constipation, and one of the natural remedy to help this problem is a concoction of honey and lemon. Now, this is not just good for sore throat if you have something that's building up, but also if you have problem visiting the toilet, if you have defecation issues, then this could be one natural remedy that could really be helpful if you keep it at your fingertips. So it's a very simple step here. All you have to do is just squeeze in half a lemon. This is fresh lemon. All right, squeeze it in there into a glass of room temperature water. And you mix in a tablespoon of honey. All right, so if you get the natural honey, that's even better. All right, so there you go. Use a plastic spoon because according to some of these documents that we found online, if you use a metal spoon, that can actually impair with the nutrient absorption. If you want to kind of, take in the full nutrients, all right? No oxidation there. Then you just use a plastic spoon, just mix it all in, and there you go. That's one of your natural remedy for constipation. So if you want to find out more natural remedies, what other tips that could really help you with your toilet visits, here they are. A good few tips there on natural remedies to combat constipation. Now, if you suffer from constipation, if you know someone who is suffering from it, or if you have any questions pertaining to constipation, you can call us. We have our experts in the house. We have a doctor as well as a dietitian. Number to call is 0355690349. Our lines are currently open. All right, back to our doctor here and Sandra. So Sandra, now I've made this concoction here. I mean, you know, this is a great thing to have, even if you don't have constipation. Yes. But what about lemon and honey and warm water that can really help you? Do you know?
Reason behind, I think, is because of because from the lemon, it's a fruit. Fiber contents definitely over there. Other than that, vitamin C, antioxidants. So in terms of skin, in terms of regenerating cell, all it helps. Other than that, honey. Good for immune system. So generally, it's a good drink. And in fact, when you drink this thing, you're actually increasing your fluid intake.
There you go. Okay. Now, we know that the digestive tract from the mouth to the anus, it's a very long one. It's like, what, 9 meters?
Around there.
Around there. That is really long if you lay it out. So, doctor, you know, for peristalsis, you know, for healthy movement to go from the mouth to the anus, apart from vegetables, what other, you know, tips that you can help us out?
In the sense that water, basically fruits, and basically anything that has high content of fibers.
Okay.
Okay.
All right. So fiber, I mean, we have things like, when we Asians eat a lot of white rice, a lot of white noodles, right? So is there something that perhaps could lead to constipation if we don't consume complex grains like brown rice or even brown rice noodles? Do you think that affects it?
Okay. Now, what I noticed that, especially I think we all know, a lot of fast food are growing, fast food. And most of these fast food are mainly meat-based. Very, the fiber or the vegetables or the fruits content of those as well. I think that is what we are seeing now in today's population. You know, there are too many fast food going on. Everybody is taking that. And as such, the number, the content of our fibers, fruits and vegetables content of our food has decreased. And that is the reason why nowadays our population, constipation is more frequent. Now, if you were to think about it, our great-grandfather, grandparents, they don't have constipation problems.
If constipation, if you leave it untreated, now you're saying it could lead to serious issues like cancer, like colon cancer. So constipation, basically, it's one of the very early symptoms of cancer.
You can say so, or to be more precise, change in bowel habit. That is to say, if someone has been passing motion, like for instance, once a day or once every other day. But now you find that increasingly difficult to pass motion, like need to go to pass motion only once or twice a week. So that is initial symptoms.
Wow, okay, that sounds rather painful. Okay, we have a caller joining us. Good morning, Mr. Lim.
Good morning.
Hello, good morning. Hello, good morning.
Good morning. Yes, you have a question, something to share?
Yeah, inquire. What about drinking tea, Chinese tea? Will it help in constipation?
Okay, all right. Thank you. So, Sandra, this is a question for you. Is tea drinking something that's helpful to constipation?
Okay, I think tea that Mr. Lim mentioned is similar as what we mentioned earlier, caffeine. Yeah. So it helps in stimulating the bowel movement, but however, it has a dehydrative effect if you does not drink sufficient of water.
Okay, all right. Now, let's also ask the people on the street, what do they do when they are afflicted with constipation?
Minum air teh pekat, sapu minyak. Makan ubat lah.
Eat healthier, eat more vegetables, fruits, work out. I just drink more water and try to take yogurt.
Drinking lots of water and eating lots of fruit and vegetables.
I heard 100 plus work, I don't know, I guess so.
Leading a healthy life, going to the gym, work out and eat healthily.
Minum teh. Minum air banyak. Keep hydrated and makan pil, cakap tengok.
Firstly, they have to understand or rather be aware that they are suffering from constipation which is they wouldn't know what is constipation unless when they find it difficult to go to flush it out in the toilet. So that is quite a difficult thing, you see. So once they are aware that they are suffering from constipation, very simple, all they need to do is take in a lot of fruits, especially banana will help. At least drink 1.5 liters of water, which is a difficult thing in the beginning, but later on it will be very easy. After 1 or 1.5 hours, after drinking these 1.5 liters, you will have the urge to go to the toilet.
Normally, I would try to eat some fibers, like eating fruits or eat vegetables. Then I will try again.
Becoming a vegetarian, because the people who get constipation is because of taking too much of meat, stuff like that.
Usually I'll take plain water, and again I'll trace back what I eat.
Just keep on eating fruits. Papaya, that's good, yeah. And drink plenty of fruit.
Better see the doctor lah. Drink water and see doctor, that's all.
Eat more fiber, fruits, vegetables, and stay hydrated.
Well, it seems that a lot of people are on the right track, saying that, drinking a lot of water, eating lots of fibers, fruits and vegetables. Now, being a vegetarian, do you find a lot of vegetarians being afflicted with constipation? Doctor, from your experience?
I don't think so, provided they drink a lot of water.
They drink a lot of water.
Yeah.
Okay, now how about the importance of intestinal microflora? Things like yogurt or even fermented food. Does that help with constipation, Sandra?
Of course, those will form some fermentation and it helps in movement, all this thing. But at the end of the day, they are actually fiber.
Okay.
Yeah, all these prebiotics, they're actually fibers.
Right.
So it helps in movement, all this thing, but you still need a lot of water. In order for the stool to move out from the body.
I see. And there's also this popularity of fermented drinks, things that are in a bottle. They say it's a cultured food. It helps with your toilet visits. I mean, is there any truth to that?
Yeah, it's true.
Okay.
It really helps.
So it helps with your defecation?
Yes.
Okay.
But of course, constipation, we need to work hand in hand and feels factor. It's not just one food itself can help.
Okay, all right. Now, doctor, we talked a lot about diet, about different types of food that will help with constipation. But how about the importance of exercise?
Yeah, it's very important. This is very true because, like you say, some people used to say that constipation will affect the elderly group. That one of the reasons is because the elderly they don't move more often.
I see. Okay.
So exercise definitely will move, and whether you believe it or not, when you exercise more, actually your intestine also move more.
I see.
It actually increase the peristalsis.
I see.
Yes.
So there you go. If you move your body, and is there any form of exercise? I mean, is just plain walking for 15 minutes, is that good enough? Or do you have to do something that is cardio workout, like jogging or cycling or swimming?
No need.
No need.
Plain walking will be fine.
Plain walking would be fine. Okay, so basically you're saying it triggers the peristaltic movement of the colon and the intestines, and that helps push things down.
Yes.
Oh, that is fantastic. Okay, now how do you kind of normalize, if you face up with constipation, normalize your bowel movement? Sandra, what are the first few things that you advise patients?
Okay, as we mentioned just now, constipation happens not because one food or food itself. It works hand in hand in other things, fluids, exercise. Another thing we'd like to highlight, as doctor already mentioned, is regarding fats. If let's say we are consuming too high fat food, it actually slows down the digestion. So the movement of the bowel slows down, constipation can happen.
Right. So when you say fats, it could be, a lot of
red meat,
a lot of meat produce,
fried food, deep fried food.
Deep fried. Dairy?
Dairy, there's a different story.
Okay.
Maybe it's because usually happens on excessive consumption of dairy.
Okay.
Due to the reason behind can be due to calcium concentration.
Right, I see. So if you are taking meat and fish and stuff, you need to supplement with a larger portion of vegetables and grains.
Yeah, meat mainly is red meats because their concentration of fats in that is higher than compared to white meat.
I see, okay. Now, doctor, with the patients that you treat, surgically or even non-invasive, what are the common symptoms that you see in the condition of the colon?
Okay, constipation and of course bleeding per rectum.
Okay.
You pass blood in the stool.
Right.
Yes.
Now, can constipation in the long run cause pockets to form in your colon?
Yes, that is what the condition called diverticular disease. And constipation, apart from causing, increasing the risk of getting colon cancer, can cause diverticular disease and of course, piles, hemorrhoids.
Okay, all right, wow. So if you have constipation, if you do not treat it and you let it go, then it becomes something serious.
Yes.
So if for someone who is faced up to constipation, how long would you say that they have, doctor, you know, to self-medicate, self-treat themselves before they should be seeking a professional's advice?
No, I think there's no hard and fast rules about this, but just say someone have constipation problem. Okay, they're probably from the internet or from their readings and everything. They knows all these natural remedies and what.
We just asked Mr. Google. There you go.
Okay, you try on it. If it's work, that's very good. And then some of them, because of, you know, a bit of reading and all these things, then they will start thinking of using laxatives. Yeah, I mean, my word of cautions about laxatives is two things. Do not be dependent on laxatives. I have patients that if they don't take the laxatives, they can't go to the toilet.
Oh dear.
Yeah, now that is what we don't want. Okay, I mean for short-term relief, that's fine. But eventually, actually, when we go into the history and what we actually find out that it's mainly water and fibers content. They don't drink enough of water. They don't take enough of fruits and vegetables. I think that is the main reason.
I see.
Though there are some medical conditions that can lead to constipation, but generally speaking, it's the lifestyle,
I see.
the habits.
Okay, so if you're dependent on laxative, what can happen in the long run?
Of course, number one is without laxative, you can't go to the toilet. And number two, actually, most of these laxatives, they form a lot of gas. So patient will feel bloated, gassy, having a lot of wind.
Okay, well, we're going to take a quick break. And when we come back, we're going to talk about this wind condition, this gas condition, and, you know, just feeling a sense of bloatedness. What causes it? More on that when we come back. So if you're connected to us via Facebook or even our Instagram and Twitter accounts, our handle is BellaNTV7, you would be knowing what's in store, you know, the merchandise, the free tickets, and what concerts or events that were happening around town. Okay, so stay connected to find out how you can grab those One Direction tickets. Now, talking about hemorrhoids, talking about constipation on our topic here on Bella Confidential, someone wrote to us about her bleeding problem in her stool, and she was a little shy to discuss this openly, so we are going to penetrate this topic rather deeply and find out what really is hemorrhoids. Take a look.
Wasir, you say? Hemorrhoids are clumps of blood vessels of the rectum. Sometimes they swell when the veins enlarge and their walls become stretched, thin, and irritated by passing bowel movements. That means it can be caused by obesity, pregnancy, straining on the toilet, sneezing, coughing, which all sounds too familiar to us. And the more you strain during bowel movements, especially with constipation, the easier hemorrhoids are likely to be caused. Maybe a lifestyle and a diet change for prevention? Let's have that discussion with a doctor. Over to you, Lisa.
So there is a graphical description of what hemorrhoid is. Now, like constipation, hemorrhoids affect more women compared to men. So, Dr. Kwan, why is it again that women are being the target of this?
Okay, apart from where I mentioned that women seldom drinks water, I think another factor is because especially from childbearing women, when they give birth, especially through the natural way of giving birth, when they have to strain very hard. Now, hemorrhoids, everybody has hemorrhoids. That is something that I want to let the public know.
Right.
Everybody has hemorrhoids. Hemorrhoids are natural occurring anal cushions.
I see.
And it's actually involved in maintaining the continence of our, that is to say, when we when we are not passing motion, actually air also can't go past our anus.
Right.
Yes, because of hemorrhoids.
I see, okay.
Okay, in the Malay they say kedap udara.
Right, okay.
Now, the only problems happens when the piles or these hemorrhoids become bigger, swollen, then it becomes a disease. And all these things happen because the connective tissue that supports this anal cushion is weakened, and then it descends.
Right,
That's what happens. And straining obviously is one of the main causes.
Right. Now, is the toilet construction affects, you know, hemorrhoids and the likelihood of hemorrhoids? I mean, if you have a sitting toilet as opposed to a squatting toilet, will that make a difference?
Yes.
Oh.
To a certain extent.
How would that make a difference, Doctor?
Well, actually, because a squatting toilet, I think, is more taxing.
Because you're obviously on your on your legs.
Yes. Yeah, it will be more taxing. So you need to strain more. Yes.
Okay. So wow, that is something to take note of.
Yes.
Okay. So straining. Now, if you don't feel like going to the toilet to do number 2, then you should not be forcing yourself, because you're saying if you force yourself, then that could lead to bleeding and hemorrhoids.
Yes. I would say that when you force yourself, that means you strain and strain and strain. You just weaken the connective tissue and the muscle around the area.
All right. Now, Sandra and Doctor, we have this tips here, remedies, and they are the natural forms to treat if you have hemorrhoids. Let's take a look. Natural remedies for hemorrhoids. So it feels like if you have something that's warm, that is soothing and calming, it feels really comfortable for sufferers of hemorrhoids. Now, Sandra, for a patient who has hemorrhoid, what would you suggest to them in terms of their diet?
Okay, so when hemorrhoid happens, it's actually a flare-up and inflammation happen. During these conditions, of course, we will ask them to stay away from spicy food. And other than that, although that we always mention fruits, fiber, all this is good from easing constipation, but this timing is not the suitable timing that you bulk up your fiber intakes. Because too aggressive is actually cause the movement of the bowel become too drastic from previously. So it actually worsens the conditions.
So what would you suggest?
So we will increase bit by bit fiber content. You start eating fruits and vegetables, but not in a bulk amount, and then drink sufficient water.
I see. So is to continue taking grains? I mean, is grain something that you would advise?
Yeah,
Okay.
But it's not an excessive amount that every single meal I must have roughage all this food.
Right, okay, so to gradually increase it. Okay, now doctor, gas, bloatedness, you know, feeling of this discomfort, these are very common symptoms. Now, if you have like lots of gas and you have chronic gas problem, is that something to be worried about? Is it a toxin buildup?
Okay, when someone has a lot of gas, they burps a lot or they have a lot of flatulence. Okay, basically, as far as I'm concerned, there are 3 conditions that will cause this. One is patient has some gastric problems. Number 2 is patient has constipation. I think all of us know very well, if we have not passed motion for a couple of days, we tend to have more gas. And the third one, which is the microflora environment in the intestine is not so healthy. So basically, we have some bacteria who is gas forming in the intestine. That's why we pass a lot of gas, and that's why we feel very gassy. So that is one of the reasons why the so-called theory of probiotic in the treatment of this kind of patients.
I see.
Probiotic basically putting in good bacteria into the intestine to make the intestine environment healthy.
Right.
Yes.
So we cannot underestimate the importance of having good bacteria or probiotics. Would you suggest taking probiotics daily?
Yes. Probiotic and supplements are two different things. That's what I want to make a point here. Now, we only give probiotic as a treatment rather than as a supplement where people keep taking it and all these things. And for us, we'll give the patient probiotic maybe 2 weeks to 1 month. And as long as the symptom has subsided, I think we should stop.
Oh, I see. So it's not a daily thing.
Yes.
It's not something that you depend on.
I don't think so.
I see.
Yes.
Okay, that's interesting. All right, thank you so much, Dr. Kwan.
Yes.
Thank you, Sandra, for stopping by and educating us so much about constipation as well as hemorrhoids and some of the remedies to treat it. Now, we have learned so much the importance of roughage, the importance of dietary fiber like vegetables and fruits, and having at least 25 grams of fiber daily for women and 30 to 38 grams of fiber for men. And also, you know, just making sure that you drink lots of water, and don't forget, exercise helps the peristaltic movement of the colon and the intestines, and it really triggers your healthy bowel movement. So that's something to bear in mind. Thank you so much to both of you. We're going to take a quick break, and when we come back, there'll be lots more happening here on Bella Confidential. It's all about entertainment.